Most of the food sensitivity testing out there is bunk. Like it's not good quality testing. So, and the problem is that, you people do mail order, people will go into a doctor's office and think they're getting a quality test with good data. And my experience is that 80-90% of them literally suck. So if the data sucks, and I'll tell you, how many of you done food sensitivity testing and came out being told you were allergic to 80% of the food on the planet? That's not real. It's not real. And it really bugs me. And then that justifies a lot of people going on these elimination diets where they eat 6 or 7 foods, causing severe nutrient depletion, which then causes more pain, which we'll get into another cause. What is the role of food as a hidden cause of pain? I'm going to ask you guys, give me some feedback here. How many of you already know that when you eat something, it causes you to have more pain? You know food causes pain. How many of you know food causes pain, yet your doctor doesn't believe it? I would probably say everybody. Because doctors are not trained to understand the role of food in causing pain, inflammation, or autoimmunity. And testing sucks. Okay. So we are really like in the wild, wild west out there, and you know it. They don't. So what do? You internet research and you go on elimination diets. So what I'm going to tell you is food 100% can cause pain and flares in autoimmune, period. And there's many mechanisms of it. There's a reason for this is because the allergenic components of food is actually pretty high. Okay. And your body's immune system is already mistaking in autoimmune disease. Your immune system is supposed to look at a germ that's outside your body and says, "You're a germ, I'm going to kill you." But instead, your immune system mistakes your own cells on your body, like your joints or something, and says, "You're a germ and I'm going to kill you." Now it's already making those mistakes. Is it going to mistake more and more food as foe? Yes. And so that's why for me, it's really important to cut through the bull and not just go on. Well, okay. So it's going to get into the weeds. And I hate getting in the weeds and being controversial. Elimination diets can work for some people, but they're not meant to be long term. Long term, they can actually be really damaging and depleting to your body. And very limited diets over abundance of eating certain types of food over and over again can also increase their allergenic ability on your body. So for me, it's really important to get some data around it, which is why in our program, Transform Autoimmune, we have food mapping, literally a blood test to show which foods is triggering the pain in you. So for me, that's really eye-opening. It's clear. And in our program, I go through that with people in our program together. You really learn exactly how to look at this data and know which foods do I got to eliminate and which foods do I got to reintroduce back. And most people are reintroducing. So it's this allergy component in food that really often is it causes a war zone in your gut, and you're creating a warring environment with your immune system and the food. And when it's warring and battling with the food, it raises that whole warring allergenic war. Guess what happens is this war produces a lot of factors that can trigger pain. And this war then doesn't just happen in the gut. It goes from the gut into your bloodstream, into the rest of your body. You're creating a massive war zone all over your body. So it's really important, and I'm setting a really clear intention, is you got to have data around food, and you have to do accurate food sensitivity testing. If you want to learn more about food mapping, comment in the food mapping section and then check your messages, message requests from us, and we'll drop some resources just to learn more, because there's a huge difference between food sensitivity testing out there, elimination diets, and what we do. You got to cut through the BS and get some really good data on your side.
So Julie said, what's so special about food mapping that isn't with food sensitivity?
Oh, okay. Gotcha. Thank you. That's a really great question. And I've explored that plenty in some of our food mapping walkthroughs in the Facebook group and on YouTube channel. That being said, so my issue is that most of the food sensitivity testing out there is bunk. Like it's not good quality testing. So, and the problem is that, people do mail order, people will go into a doctor's office and think they're getting a quality test with good data. And my experience is that 80-90% of them literally suck. So if the data sucks, and I'll tell you, how many of you done food sensitivity testing and came out being told you were allergic to 80% of the food on the planet? That's not real. it's not real, and it really bugs me. And then that justifies a lot of people going on these elimination diets where they eat 6 or 7 foods, causing severe nutrient depletion, which then causes more pain, which we'll get into another cause. So what I can tell you is that what's really different is, number 1, you got to get the right test. I have sampled hundreds of them, and I know which test is best, especially for people with autoimmunity, because people with autoimmunity have really revved up crazy high or crazy low immune systems, really burned out. And so it can cause a lot of false positives and negatives. So we absolutely do the best test for people with autoimmunity in our program. But more importantly, I love training and educating people in our programs. People in our program will tell you they've been through thousands of dollars with doctors and testing and stuff. And what they learn in this program and how we do it, completely unique. It's accurate, number 1. And number 2 is I exactly go through with you, like, these are the ones that you could eliminate. These are the ones you could reintroduce at what time, right? And these are the ones that you can reintroduce right now. And here's how you fall back in love with food, because I'm a foodie. I love to cook. And if you haven't seen my recipes and me in the kitchen, check out those videos. Okay. It's all over YouTube, IG, and in my Facebook group as well.
And for anyone who hasn't seen Christina's video, she was eating what? Potatoes? That was it? That's all she was eating?
Christina, actually, one of our graduates, and she was talking about, she had gastroparesis, Sjogren's, lupus, and POTS, dysautonomia. And she said that at her anniversary dinner, like with her husband, she could only eat a plain baked potato while he ate his whatever. And that is the reality of what food elimination diets have put people into severe autoimmune disease with. Her symptoms were worse than ever, and she was eating less than ever. And the thing is, you just need data so you can do the complete opposite. You need data so you can eat more than ever and feel confidence in what you can reintroduce based on data and mentorship. So that's really important. So that's the big difference between our food mapping process and anything else that you're going to do out there.